Hello, everybody. Good morning, good evening, good afternoon. Welcome, welcome. My name is Dr. Catherine Duggan. I am the Chief Executive Officer of FIP, and it's a great honour today to moderate this session, an anniversary event of the Astana Declaration. And the title of our event today is From Astana to Today, Celebrating Progress in Primary Healthcare and Global Health Advocacy. We've got some speakers to run through. We've got a panel discussion, and we'd welcome a lot of interaction from you all. Before I get started, I'm just going to read you through some of our normal housekeeping announcements. We're recording the webinar right now, and it's being live streamed via YouTube. And this means any of your colleagues who are not able to attend now can access the event later, and the recording will be available on our website at www.events.fip.org. You're very welcome to ask us questions in the question box and even the chat box, and introduce yourselves to each other through the chat box. And we have some of the team here who will monitor this. And you're very welcome to provide us with feedback at webinars@fip.org. We'd also really encourage you to become a member of our great federation at www.fip.org/membership_registration. So we're very happy to have you here today. And for those of you whose English is not your first language, we've got a translations feature on Zoom that you can access. There are 3 steps to that listed below. Step number 1, turn on the captions. You should see a little box saying CC. And then you will be able to select the translation that you wish on step 2 and step 3. And if you have any problems, just drop us a note in the chat box and one of the team will be able to help you. But translations makes it much easier. So we'd really welcome you being part of that. Lovely. So the programme for today's event is some welcome and introductions by myself to the FIP Primary Healthcare Programme. We'll then walk you through the new FIP Strategic Plan, which was ratified by the FIP Council when we met last month in Copenhagen. And we've aligned it to our World Health Assembly activities to really draw a line between strategy and advocacy. We've got a session then in the middle of the programme on the impact that we're having at the World Health Assembly and some reflections for you. And then advancing primary healthcare through medicines and pharmaceutical services. That's a substantive presentation. We'll then go to our panel discussion. Then there'll be an opportunity for you to ask questions and the panel can answer them or just even contribute in any way. And then some time for closing remarks. So we'll look forward to filling up the agenda with you as such. And by the end of this webinar, we want you to be able to describe the role of pharmacy in advancing primary healthcare. It's known globally as PHC, through the FIP Strategic Plan that takes us through to 2030 and our FIP Development Goals. We would want you to identify key achievements, challenges and opportunities in strengthening PHC worldwide, and to reflect on how our global health advocacy can support equitable access to medicines and health services, influencing policy at the World Health Assembly. After all, many of you will know we have a campaign that is ongoing, more than a year and a half old now. It is when health ministers think health, we want them to think pharmacy. So today's speakers, it gives me great pleasure to welcome the speakers listed here. Some will be speaking at different points in the presentation. Unfortunately, not everyone is able to stay until the end because they have other prior commitments. So we've scheduled the agenda to make sure we get the most from them. And I'll introduce you to the panel when we get to that item later in the agenda. But without further ado, it's my great pleasure and joy to welcome Mr. Paul Sinclair, the FIP President, based in Australia, so it's already very late and it will only get later, Paul. Over to you for your welcome and introductory words.
Thank you very much, Catherine, and welcome everyone to this important webinar tonight. And it's nice to see such strong numbers attending. Thank you, Catherine. Yes. FIP attended the Global Conference on Primary Healthcare in Astana, Kazakhstan, and was a signatory to the Declaration to Commitment to Strengthen Primary Healthcare. Since then, the Federation has worked to strengthen pharmacy's contribution to and impact on primary healthcare. We know that pharmacists practicing at the heart of communities around the world make an enormous contribution to primary healthcare. They have the necessary expertise, and we believe that they are the most accessible primary healthcare providers. Therefore, there is no primary healthcare or no primary care without pharmacy in all sectors. Thank you. So how do pharmacists drive better patient outcomes and their impact on primary healthcare? Pharmacists are accessible, trusted, and available without appointments in most situations and play a key role in delivering primary healthcare, making universal health coverage a reality, especially for underserved populations. In many countries, pharmacists now administer vaccines, prescribe for minor conditions, and conduct point-of-care testing for flu, cholesterol, and infections. Pharmacists amplifies health system capacity by making services more accessible, affordable, and equitable, directly supporting universal health coverage's goals of access to quality health services without financial hardship. Thank you. FIP has a primary healthcare program, which is a global health priority for the Federation. Under this program, various activities have been conducted, which I will share in my next slide. To learn more about FIP's contribution to primary health care, you can scan the QR code on the screen or visit the website underneath the QR code. Let's look at a few of the recent FIP resources available on primary healthcare. Firstly, the FIP Regional Conference Report on Delivering Primary Healthcare provides an overview of the primary healthcare priorities and needs in the European region and roles of pharmacists in advancing primary healthcare and key messages covering topics such as non-communicable diseases, digital health technologies, vaccination, workforce transformation, education and training, medicine shortages, access to medicines, healthcare systems sustainability, empowering communities, prevention, pharmaceutical policies, and investment in primary healthcare. Secondly, the FIP Global Commitment to Action on Primary Health Care includes 15 actions such as transforming pharmaceutical services and delivery of primary health care through needs-based pharmaceutical education strategies, and continuing to ensure patients and communities receive appropriate, effective, safe, people-centred, timely, accessible, transparent, evidence-based, equitable, and integrated pharmaceutical care. There is an FIP Primary Healthcare Digital Toolkit. FIP has also conducted a global summit on primary healthcare in 2021. It showcased how pharmacists can utilise and contribute to the WHO operational framework and explored the strategic levers needed for pharmacists to strengthen primary healthcare. FIP also celebrated the 5th year anniversary of Astana via a digital event focused on trends, gaps, challenges, and opportunities in the field of pharmacy and its relation to the UN Sustainable Development Goals, universal health coverage, and of course, primary healthcare. The FIP Primary Healthcare World Map includes 50 videos from 27 countries to highlight good primary healthcare practice examples from the 6 WHO regions aligned with the prioritised indicators. And finally, in the primary healthcare self-assessment tool, there are 27 FIP primary healthcare indicators which reflect the progress towards achieving primary healthcare goals. Upon completion of the tool, respondents will receive a total score that shows their progress within the pharmacy context. Thank you. Primary healthcare is key to achieving health for all. In 2018, through the Declaration of Astana, governments recommitted to strengthening primary healthcare as a way to achieve universal health coverage. We want everyone to think about pharmacy when they think about their health. We need policymakers to think about universal pharmacy coverage when they think about universal health coverage. I would like to invite you to support our global advocacy campaign for the pharmacy profession. More details of this campaign are available by scanning the QR code on the screen. Thank you again to all of you, and thank you, Catherine.
Thanks a million, Paul. Very well said. And it must be said as well, Paul and colleagues who are in attendance, that prior to the 2018 celebration of 40 years of Astana, pharmacy was not signed up to delivering that. So we put that right, and our amplification of our profession wherever people have their primary healthcare delivered and wherever pharmacy is based is really second to none. So it's really important as we seek to get the attention of health ministers, finance ministers, governments, World Health Organizations, other United Nations agencies, that we do this through shared endeavors, shared values, and alignment. So it's very important for us to align FIP with the global health agenda. And we took the opportunity upon signing pharmacy up to primary healthcare through the 2018 Astana Declaration to align and integrate our pharmaceutical practice, our pharmaceutical education and workforce development, and our pharmaceutical sciences under the remit of an expanded and extended set of FIP development goals. The development goals had been developed and launched in 2013 and really focused on workforce. And at that point, they focused on the first 13 of the goals that are listed here, with a real laser sharp focus on the workforce itself. In 2020, in the midst of the pandemic, we expanded the first 13 and added the next 8. And that meant that we had a suite of 21 development goals, which start at DG1, academic capacity, and finish at sustainability in pharmacy, goal 21. And our concept there is that sustainability in pharmacy isn't just about how we use the medicines that we are central to, but also how we sustain our workforce to ensure that services are provisioned in a sustainable manner. Next slide, please. So we have 10 priority programs at the team in FIP, and they're listed here. And each of those programs are linked to big priorities on the global health agenda, primary healthcare being one of them, antimicrobial stewardship to really meet the challenge of AMR, humanitarian, safety, disease prevention, sustainability, non-communicable diseases, and self-care. And then we have our equity and equality program to make sure that we're supporting everyone, both within our profession and in the patients and the public. And then a multinational needs assessment and surveillance program. And these programs really support our member organizations to deliver the DGs that are a priority in their nation, but also to really seek to push the strategic plan forward so that we're really working shoulder to shoulder. Next slide, please. So then when we align our work to the global health agenda, we need to also think about the evidence of impact or the evidence of need that we find ourselves in. And in Brisbane in 2023, we issued a set of calls to action from the profession. That was 5 years after the Astana Declaration, and it has resulted in a global evidence-led report on how pharmacy is strengthening health systems worldwide. It was very important to mark this point. Remember, at that time, we were really just starting to see the light following the entire impact of the profession. Indeed, we had celebrated 1,000 days with the pandemic in the August of 2023. And then this report was published and launched in Copenhagen last month. You'll be able to download it by using the QR code. And it focuses on workforce transformation, practice advancement, and policy change. It is drawn upon our data, input from our member organizations and our individual members, and current examples across all 6 of the WHO regions. The report highlights global health priorities such as delivering primary health care and universal health coverage, digital health, access to medicines, which is central to FIP's vision and mission, and of course, sustainability. Next slide, please. And then, of course, the alignment with the development goals is really core. You'll see listed here the 6 strategic objectives: access to medicines and health services, person-centered pharmaceutical care and well-being, innovation and pharmaceutical sciences, strengthening pharmaceutical care and workforce development, antimicrobial resistant and a united health for all approach, leadership, governance, and global engagement. And here, against each of those strategic objectives, we've listed the primary development goals that are aligned. That's not to say that not all goals are aligned with the strategy, but for our member organisations, it's very helpful to identify the ones that are the primary strategic imperatives. Next slide, please. Now, without further ado, I'd love to welcome Mr. Luis Lorenzo, who is the FIP Professional Secretary and is actually winging his way to a WHO Europe region meeting after this presentation. Luis, we want to hear more about FIP's impact and success at the World Health Assembly. Over to you, Luis.
Thank you so much, Catherine. And as I mentioned, I won't be able, unfortunately, to stay here for the panel discussion, but I had the honor and privilege to attend the last 3 World Health Assemblies. So I would like to walk you through how FIP engages at WHO each year, starting from 2023 for a whole week, late May. So in this slide, you see that you have our through our FIP delegation, we participate as both official and full delegates. Our official delegates deliver individual statements at the Palais de la Nation, ensuring that the pharmacy profession is represented in key discussions, while our full delegates attend side events and meetings throughout the WHO. Next, we have the statements on the middle column, both individuals and constituency on global health priorities. These include issues such as antimicrobial resistance, climate change, primary health care, universal health coverage, patient safety, substandard and falsified medical products, immunization, and the health and care workforce. We also collaborate closely with partners like the World Health Professions Alliance, NCD Alliance, IDF, IFA to deliver constituency statements that amplify our collective voice. So finally, on the last column, you see that FIP takes part also in side events, advocating for pharmacy profession and contributing as a co-organizer, speaker, or panelist. These events provide valuable opportunities to highlight the role of pharmacists in strengthening health systems and achieving global health goals. Since our delegation is increasing every year, we can also send delegates to participate in other side events that when the topic is discussed where pharmacy can be involved, these delegates also raise their hands and share the potential contribution that pharmacy can provide. Overall, through these activities, FIP assures that the voice of pharmacy is heard at the highest levels of global health policy. So moving forward to our next slide, here you can see a summary of FIP activities and achievements at the World Health Assembly over the past 3 years. On the left, we have our FIP WHO report, which document our representation, statements, and advocacy outcomes each year. This report highlights how our visibility and engagement at WHO have steadily grown since 2023. On the right, the figure shows this increase in numbers. You will notice a clear upward trend, both in the number of delegates and in our active participation. In 2022, we had just 3 delegates, but by 2025, that number has grown to 33. We also delivered 10 individual statements this year and participated in over 60 side events, receptions, and network engagements. This growth reflects FIP expanding influence in global health discussions and our strong collaborations with other partners. It also demonstrates that the recognition the pharmacist's role is addressing global health challenges, from antimicrobial resistance to primary health care and universal health coverage. Overall, our participation at WHO has become not only more visible, but also more impactful, positioning FIP as a trusted voice in global health policy. I will now finish my presentation focusing on a particular event that was first organized this year, and it's mentioned on the column FIP-led events on the bottom right side of the figure. So after a long period, FIP organized for the first time a side event titled Pharmacist and Pharmacy Evidence-Based Solutions to Global Threats, brought together over 100 participants from various organizations. FIP Bureau members opened the session with presentations showcasing how pharmacists contribute to addressing pressing global health challenges such as antimicrobial resistance, climate change, and inequities in access to medicines. Their presentations were followed by a high-level panel discussion featuring distinguished speakers, including the Ministry of Health of Portugal, the Ambassador of Global Health, and representatives from WHO, the International Federation of Red Cross and Red Crescent Societies, and the Swiss Tropical and Public Health Institute. The discussion highlighted pharmacists' leadership in advancing vaccinations, humanitarian aid, and access to essential medicines, demonstrating pharmacists' critical role in building resilient health systems and supporting the One Health approach. Overall, this event successfully showcased how FIP and the pharmacy profession contribute to global health priorities through evidence-based collaborative solutions. It also strengthens our collaborations with other organizations and key stakeholders. And that's all from my side. Catherine, thank you so much for this opportunity. I hand over to you.
That's absolutely fabulous, Luis. Yes, and it's been a great journey so far. And I would say, Luis, that we've experienced the more we're there, the more people want to know about us. From FIP's perspective, we always want people to know about pharmacy and our contribution, but many people don't. So we have to be advocating all the time. Lovely. So now it gives me my great pleasure to invite our colleague from WHO Switzerland, Dr. Faraz Khalid. Faraz, you are the Senior Advisor, Performance, Financing and Delivery Department. And today you're going to walk us through advancing primary healthcare through medicines and pharmaceutical services. We're delighted to have you with us today. Faraz, the floor is yours.
Thank you very much, Catherine. Can you please confirm if you can see me and hear me clearly?
Very good. Very clear.
All right, good. Thank you, guys. Sorry, I might look like very informally dressed. I'm up in the Swiss Alps with my family for some holiday time. But since the importance of this event, so I thought it's worth taking a break with children, families all around. But I'm focused with you for the next half an hour or so. So as you can see the title here, and this is something I'm sure for this group, nothing new, but I will bring some key messages to the table from the recently released global report, which was implementing the primary healthcare approach, a primer. And I'll be talking to you from the PHC perspective, that how primary healthcare being the foundation of health system reforms, and what do we think, and from the perspective of the latest evidence collated in that global report, where it clearly says that there's no primary healthcare without access to medicines, and there's no universal health coverage without pharmaceutical services that are reliable, affordable, and safe. And in fact, medicines are proof of our service delivery. And if a patient leaves without the needed treatment, the primary healthcare is failed. So yet in many countries, we know that pharmaceutical services, they're often treated as parallel commercial services rather than they being considered as integral part of our primary healthcare orientation agenda. So the messages I'll be sharing here with you, they're derived from that recently released global report. So with this, let me take you first through the strategic framing perspective. Next slide, please. Here, as I said, PHC being considered the foundation. So I'm not so laudable. Okay, so let me get close to my laptop and hope it would be clear. So, all right, okay, for some it's clear. That's good to know. So I think, as my colleagues highlighted, Astana Declaration, and many of you may be aware of this Astana Ball, which means which brought back again the emphasis on three components of primary healthcare approach, where primary care and essential public health functions, they make together as integral part, integrated health services as the first component, second being empowered people and communities, and third, multi-sectoral action and policies. And then how we frame it that where UHC and health security are the goals, health system strengthening is the means, and PHC as an approach. And when people trust primary healthcare, when there are appropriate pharmaceutical services and medicines are available. So in this, as I said earlier, so from that perspective, pharmaceutical services, they are integral part of the PHC reforms. Next, please. What I said earlier, and if you can click on twice, thrice, I think it would come up. Yeah, so let's click, please. Esu, if you can, yeah, here. What I said already earlier, the three components of primary healthcare being foundational, they make the approach to strengthen the health systems, which are the means, and goals are UHC and health security. And here amongst that, as my colleagues highlighted, one of the important levers, operational lever, has been medicines and other health products. Do not mean these 14 levers to be acting independently or distinctively, but let me bring in the connectivity between these levers, where how do we consider each one of them as an important function or sub-function of a health system, where each lever is tightly linked to others. So let's say if we talk about the relationship between medicines and financing, so financing policies, they determine affordability. Supply systems, they determine availability. And workforce policies, they define who delivers care. Similarly, the digital systems, they support prescribing and safety. Governance, other than playing an important role in other areas, it protects the quality. So without integrating medicines into these reform levers and understanding the complexity of system, I think our health systems will stay fragmented and patients, they will fall through the cracks. So this is not just a pharmaceutical agenda when we talk about the topics we are discussing today. I think it's a health system design agenda, where we see the countries who have succeeded in ensuring that medicines are part of the benefit packages, procurement strategies, service delivery models, and primary healthcare delivery teams. So these are the countries they have been able to make better progress. So pharmacy leadership, in the end, it has to be an important part of primary healthcare decision making at the policy level. Next, please. This is just to highlight the big medicine access challenge, where access to medicines remains one of the biggest inequalities in health, where, as I mentioned, the primer for which you have the code available, it clearly brings the evidence that medicines are often the largest financial burden on households, especially those living with chronic illnesses. And in many countries, even when consultations are free, medicines are not covered, creating the hidden barriers. Frequent stock outside primary care facilities, they prevent continuity of care and force patients to purchase medicines privately at high cost. This worsens financial hardship and delays treatment. Meanwhile, we also know that weak regulation allows poor quality medicines to circulate, especially in pluralistic health system, mixed health system. And this is just not a logistic problem. Again, as I said, this is a systems problem. If access to medicines fails, as I said earlier, primary healthcare fails. And UHC, the progress towards UHC becomes more difficult. So this is why WHO has been calling for medicines policy to be repositioned as part of the PHC reform priority, not an afterthought. Next slide, please. So the messages here, they are more about embedding pharmaceutical services into the PHC orientation agenda. Specifically, as we think that primary healthcare is where long-term health needs are managed. For example, for hypertension, diabetes, asthma, depression. But yet in many health systems, medicine for these conditions are not integrated into our service delivery models. Patients are forced to travel to hospitals for refills, placing unnecessary pressure on high levels of care and leaving primary care underused. But also by embedding pharmaceutical services, I think into Yes, let's stay on this slide, please. So by embedding pharmaceutical services into our primary healthcare agenda, we keep care closer to people, improving adherence through follow-up and counseling and reducing treatment dropout. It also improves safety because we think that pharmacists are key to detecting drug interactions and duplication. That's what this PHC primer also brought in, a shift in mindset where pharmaceutical services, as I said, they are not just about distribution. They're about ensuring medicines are used well with safety and with consistency. Next slide, please. I cannot emphasize more here the role of pharmacists in PHC-oriented systems, where they have a huge responsibility because they are the ones who could be treated as the most trusted and accessible health professionals. And in many countries, they are the first contact when people are seeking care. So this makes their involvement in primary healthcare agenda very logical and essential. And hence, when we at WHO, we talk about multidisciplinary primary healthcare oriented teams, pharmacists, they play an important and unique role by ensuring medication safety, patient counseling, and continuity of care. So they support rational use of medicines, prevent unnecessary prescriptions, and play a major part in combating antimicrobial resistance. So as I also said earlier, that pharmacists, they have an important role in health literacy and self-care, both of which are important functions of the primary healthcare. So unlocking their impact, it requires recognizing that pharmacists, they're a part of the multidisciplinary primary healthcare workforce. They're not outside of it. Next, please. Talking briefly about why and how community pharmacies, they expand the primary care access and knowing that they are embedded in communities, often more so than the clinics. The proximity to people that makes them powerful assets of primary healthcare agenda, especially for early risk screening, treatment continuation, and patient follow-up. Pharmacies are often visited more than the primary care clinics, making them an ideal setting for reinforcing adherence and self-care. They can also help identify complications and early in the process of referral, where specifically avoiding unintended hospitalizations too. And I think equally important is, as I said, the role of pharmacies in counter referral, helping patients transition back to community care after hospital discharge. In underdeserved areas, contracting private pharmacies, they can expand service coverage and reduce inequities. Next, please. Some of the elements about system enablers for medicines and PHC-oriented systems. Here, speaking to the top 5-6 system enablers. First, financing. When medicines are financed publicly as part of primary healthcare, out-of-pocket spending drops and equity improves. Secondly, generic use and price regulation, it widens the access. Thirdly, last mile supply reforms, they fix the stock out issues. Both the digital solutions like e-prescriptions, barcode tracking, shared patient records, and stock monitoring systems, they improve safety and continuity. Further, quality regulation that ensures trusted care and prevents counterfeit medications. And also not forgetting that contracting private pharmacies, it helps also improve the coverage. So these system enablers, as I said earlier, these are the ones, they bring in a systems perspective where ensuring that medicines are reliable, affordable, and integrated into PHC agenda. Next slide. Some quick examples from a few countries. Talking about Brazil's program, this Pharmacia Popular program, which showed that how contracting private pharmacies, they can dramatically expand equitable access to medicine when backed by public financing. In case of Thailand, we know that embedding medicines into the UHC service benefit package, how it has been ensuring essential treatments are available at the primary care, reducing hospital dependency and catastrophic spending. Chile has demonstrated the power of generic promotion policy, where making medicines more affordable nationally. The Ghana's national health insurance scheme, where it linked the primary care accreditation to medicine availability. So these countries and successes in these countries, where they treated medicines as part of the PHC reform agenda, not a parallel supply chain issue. So we see that, and by the way, none of these countries is a high income country. So they show examples that if medicines and role of pharmacies is purposefully brought into the system, how an accrue benefits. And last slide, please. Where I think it's a call of action again for all of us, where we do not think pharmacies to be outside of our primary healthcare agenda, but an essential part of the agenda. But for that to become reality, we have to move from considering, as I said, considering the role of pharmacies as marginal, or but considering them as essential part of the agenda, but also including the pharmacy leadership into the PHC policy dialogue, repositioning pharmacists, their role in important role in clinical care, where they deliver prevention. They have an important role in chronic care follow-up and therapeutic counseling, but also integrating community pharmacies so that they're not just retail endpoints, but they are connected to primary care access points, but also evolving our payment models which support the medicine coverage, and not leaving patients being exposed to out-of-pocket spending, and thinking through how education must evolve so that every pharmacist that graduate is PHC ready. And finally, this requires collaboration between pharmacy leaders who join hands with ministries of health, partners like WHO, and different advocacy platforms on UHC agenda, where they are not just as observers, but they are co-architects of the PHC transformation agenda. So I'll close with the same line which I said earlier. I don't think there's any PHC without medicines, and there'll be any significant progress on UHC without thinking through the important role of pharmacies. So now is the time to integrate pharmaceutical services into PHC-oriented systems and make access to treatment a reality for all. I hand over back to you, Catherine.
Faraz, thank you so much. And also thank you so much for taking time out of your personal family holidays. We will keep you for a little while longer, a few more minutes in the panel discussion. And I will welcome the panelists who are listed here to open their cameras. And in our panel today, we have Paul Sinclair, FIP President, who has spoken to you earlier. We have Faraz, who's just spoken to you from the WHO perspective. We have Jack Shen, who is the General Secretary of the Malaysian Pharmacists Society in Malaysia. We have Charlie Chang, President of the Taiwan Society of Health Systems Pharmacists from Taiwan. We have Luna El-Bizri, founder and manager of Luna Farm Pharmacy, the Lebanese Order of Pharmacists of Lebanon. We have Panzu Glory, who's the national president of the Order of Pharmacists of the Democratic Republic of the Congo. We have Michael Hogue, who's the executive vice president and CEO of the American Pharmacists Association. We have Susan O'Dwyer, who's the head of professional services at the Irish Pharmacy Union in Ireland, and Luis Lorenzo, who is a community pharmacist who has leadership roles in pharmacy across Portugal and is the FIP professional secretary. Now, Luis and Faraz won't be able to stay with us for the length of the panel. So with my first question, I'm going to kind of target Luis with this. You've made a couple of points on this, Luis, for us, but attending the World Health Assembly, which is of course the General Assembly meeting of the WHO, and the associated events could be perceived as solely practice-oriented. Have you found attending WHA adds value in advancing science and education? I'm going to ask that to Luis to begin with, And then I'll also ask our president, Paul Sinclair, to respond as well. Luis.
Luis is not in the call.
Ah, lovely. Okay. Paul, and then Faraz, I will ask you too. Lovely.
Thank you, Catherine. Yes, I had the privilege of attending the WHA this year in Geneva, and it was in fact the first one I'd attended, so I had no preconceptions or previous experience. And I was taken very much by the what a great opportunity it was to not only promote pharmacy in all its disciplines, not simply practice, but pharmaceutical science and pharmaceutical education, because the WHA is effectively a melting pot of opportunity, where there are a wide range of representatives from various disease states, from various health disciplines, and pharmacy is just one of those actors. But it was certainly not just purely a practice-focused exercise. I attended a number of presentations from various disease states where there were significant learning opportunities, as well as the opportunity to interact with health professionals. That promotes the notion, as we hear repeatedly now, about interprofessional collaboration. And more those health professionals are becoming aware of the potential, the capacity, and the opportunity to engage with pharmacists. And pharmacists who may practice in a community setting or a hospital setting, pharmacists who practice in a scientific setting, who are providing a lot of the technologies and a lot of the new drug discoveries that is fueling the medicines that support primary healthcare. So, Catherine, no, it was remarkable to me to see the opportunity, and it was anything but a practice-focused coming together of health professionals. But it was very much from a pharmacy point of view, an opportunity to learn and to exercise practice, science, and education.
Thanks, Paul. And Faraz, for you, maybe we haven't explained fully that we represent all in the world of pharmacy. So we represent our scientists, our educators, our practitioners. Of course, WHO is really focused on the practice and the policy of global health. What would be your words of advice to our scientists in our science communities and our educators, as well as our practitioners and our policymakers, for why they should attend the World Health Assembly?
Well, yeah, sure. It's not an easy question, I must say, guys. Yeah, but I think this World Health Assemblies it's usually an event, a platform which could serve. I mean, I can go on and on, but it can serve on for advocacy, diplomacy, partnership and coalition building, knowledge sharing, but also if I really have to give some specifics to each of these words I talked about. So let's say if there's something which is more you would want to really take up at the global or the regional level, that's a platform which gives you, even if it is not a session in the Peleas per se, because now we are more and more realizing that using World Health Assembly like I think hardly maybe 1/4 or 1/5 of the events they happen in an official capacity in Pele, but there's so much happening around where people are able to network, collaborate, and bring the agenda. So one is being part of the formal ceremony, formal program, and B is like if you have something which you want to discuss at the global level, there's so much happening outside that. That's one.
And we sometimes call those side events as though they are on the side or they are aside, but they are just as impactful, Faraz, aren't they?
Indeed, they're just
lovely. Look, I'm going to target another question to you so that then you can feel free to leave and get back to your family time, Faraz, today. But I think the question I have on my question list really fits with some of the questions in the Q&A. From your perspective, what key system enablers are needed to ensure equitable access to essential medicines through primary healthcare?
Sure. So I think this is what I already talked in my slides, where we had 6, 7 key levers, and I would say that the magic bullet here is imagine the complexity of the system and the interrelationship of different levers or health system functions, where we really have to think through that how governance, financing, health workforce, supply chain, different elements, levers, functions, whatever you call, depending on what framework you use. But the interconnectivity of them, I think that actually helps us to make medicines and pharmaceutical services to be more affordable, accessible. Because as I said earlier, financing can bring the affordability element, but without health workforce, because without intact supply chain systems, you cannot make them accessible. So the complexity of the system and the interrelationship of different functions, sub-functions, and the levers of the system, whereas much as each one of us will be playing a role on our own sub-function, our own area, but embracing the systems thinking, I think that helps us bring those system levers to the ground.
That's a wonderful, thoughtful response, Faraz. And I think for pharmacy, as we think about our role at World Health Assembly and then across the rest of the year, we have to think as a collective system of being there to ensure access to safe, affordable, and effective medicines wherever we're working. It comes to Paul's point, whether you're a scientist, whether you're a policymaker, whether you're a regulator, an educator, that really doesn't matter. We need to show up and advocate for how we can contribute. Faraz, that's absolutely amazing. I'm very happy for you to stay and to contribute where and when you might see fit. But also, I am aware that you have got a family in the Swiss Alps, so you might need to get to them. So what I'm going to do now is I'm going to go to Paul again and thinking about this integration word, Paul, how can we integrate practice, science and education to achieve sustainable progress in primary healthcare? And then I'm going to open it up to all of our other panel members. Paul.
Thank you, Catherine. Yes, look, it's just giving this some thought. It's interesting that the FIP World Congress of Pharmacy in Montreal next year has as its theme One Health, One Pharmacy, bringing science, practice, and education together. It really does highlight that pharmacists' evolving role in disease prevention, health promotion, and research while promoting interdisciplinary education. I think it's we need to integrate science, education, and practice to affect the best possible outcomes for our patients in delivery of pharmaceutical care. We can't have them operating in silos or totally independent of each other. And in fact, we've gone through the exercise and we're in the middle of a transition at FIP to integrate science, practice, and education into one board rather than having them fractured and in silos as we have in the past. So it's I think it's inherent on and I note a comment from Dr. Faraz was that pharmacy graduates need to be primary health care ready. That means that they are educated and they have the knowledge and they have the access to the scientific developments to implement primary health care so they are practice ready when they graduate or finish their formal training. So I think we have to we have to be prepared to adapt to new technologies. We have to be prepared to continually educate ourselves to deliver these new health technologies and new medicines and whatever form they might be. But more and more, we are practicing as a result of better utilisation and better education so that outcomes are best delivered by that integration rather than totally separate disciplines. So I think it's something that we now do almost as a matter of course, and we have to do it going forward if we're going to try and get the best possible outcomes for our patients.
And it's something, Paul, we have to keep explaining, repeating, reiterating in the loop of impact and evidence. Absolutely. So that's a bit of a note for all of my colleagues on the screen here and for the team at FIP. We constantly have to amplify what we're doing in our practice. So my next question will be targeted at Luna, Charlie and Susan, but I'm very happy for the other team members, the other panelists to contribute as well. There'll be other questions for you in particular. So Luna, Charlie, Susan, welcome. You have represented FIP at several side events during WHA in Geneva. How do you plan to apply the knowledge and insights gained while you were in Geneva to your work or initiatives in your country? And then my follow-up question will be, how can we help you at FIP? You can take that, Charlie first, Luna, and then Susan.
Okay, thank you, Catherine. Actually, serving on the FIP delegation at the WHA was a tremendous learning experience. Actually, beyond learning diverse perspective from global health leader, we used the WHA gravity to convey a medication supply forum. So I'd like to show you my experience of specific on this part. Because we use this occasion to bring together pharmacy leaders and experts who were already in Geneva. So 2 years ago, Taiwan Society of Pharmacy also held the same topic seminar. So with FIP's strong support, we scale it up and engage international partners, including WFPHA CEO and EAHP President Nina. So also our panelists here today, several. Yeah, so for this specific side event, what I take home and how I apply is the first is we learn from the ENA and the EAHP approach. We found that the regional cooperation model is very important. And also, we learned that evidence-driven essential medicine policy, because we will update our essential medicine list. The methodology is very important. So we can weigh the supply stability, vulnerability, and the real-world utilization data. It's more feasible to make a better essential medicine list for our country. And also for the distribution inequity, the community pharmacy as a resilient node, we will pilot joint procurement and the inventory pooling among community pharmacies with fair allocation rules during shortages and create a rapid therapeutic alternative. So what's the next step? Actually, we are planning to run a follow-up forum during the next year's WHA, maybe focused on supply chain resilience and regulatory convergence. Maybe we will talk about the upstream pharmaceutical industry. And I recommend you may consider a companion session on the role of the pharmacists across primary healthcare aligned with today's topic. Thank you. This is my feedback.
That's
Thank you.
great, Charlie. And I have to say, I love this loop where you're learning from others who are in attendance to help you implement change in your country. But then we use that example for others to learn from as well. So there's something very beneficial about the learning loop here. Luna, what were your reflections?
Well, I had the opportunity of representing FIP, and at the same time, I was there as a representative for the Lebanese Order of Pharmacists. And to be very honest, it was a very enriching experience because it provided me with valuable insights into how global discussion about universal health coverage, since we care about our community pharmacies, and how we have to translate this into practical country-level strategies. So to be honest with you, we have started this year to include new thinking in the Lebanese Order of Pharmacists, because we were caring about vulnerable population, about equity, about equality, about mental health, and we have divided our work this year into 4 axes, if you want to say. It was an implementation about the global discussion that we have seen about all those items at the level of globally. So we held 2 congresses. The last one was this Saturday, and it was the first time to talk about women health. So we had 2 congresses talking about women health, not only physically, but also mentally. And the last one that has been this Saturday, it was about deep collaboration between different stakeholders, because invitees were not only pharmacists, they were from the community, from the government, the Ministry of Public Health, and we were raising the awareness about breast cancer, since it is the month, showing that pharmacists are here to play a vital and important role. We are not only dispensers of medicine and that's it. No, we are here to encourage people to make this screening and to be embedded in these things. The third pillar was the education of the pharmacist about antimicrobial resistance, because one of the most important things, and we have really a huge problem here in Lebanon about this. And the third axis was about delivering in a very equitable manner the medicines. When we had the conflicts and war during the 2024, we were one of the active players for these displaced people that were coming to the safest area, and pharmacists really done a very excellent job. And finally, this year, we introduced talking about mental health. So as you can see, these global discussions, these global threats are implemented as Lebanese Order of Pharmacists. Yes, we have lots of things to do. Yes, we need to be embedded in the policies, not just as observers, but as active players.
Yeah.
And this is something that we have to do more.
I think, Luna, this is very important for us to say to our profession. We need to be participants in the policy and strategy setting, not recipients of what those policy makers think. So that involves quite a lot of work to get up to that leadership level. And Luna, may I just make a mention, colleagues, those of you that may not know, we did an event a couple of weeks ago on World Mental Health Day for those who are living in emergency situations and disasters. And we had thousands of attendees at that. I have to say, a real testament to my pharmacy colleagues who are also citizens going through the emergencies and the wars and the crises on the ground, serving their populations as well. So the mental health issues that can be impacted by the responsibilities you face, Luna, can't be understated at all. So real testament to that. That recording is available for anyone who wishes to download it. And as I say, I think it was up on 8,000 colleagues attended that event. So very necessary. Susan, without further ado, what are your reflections from the Irish Pharmacy Union perspective?
Thank you, Catherine. Like the others, I would echo that it was a really, I suppose, enriching experience being out at World Health Assembly, kind of understanding that we have a lot of shared global priorities and we might all be at different stages, but there's a lot that we can learn from each other around the various different areas that we're all working on, things like antimicrobial resistance, immunization. The health and care workforce was one that struck me a lot because we've had some challenges in that space in Ireland in recent years. And sometimes you think the answer is to bring in colleagues from other countries, but actually that has an impact then in the other countries. So how do you actually ensure that as a global community, we're all working together and trying to ensure that we're looking after the profession in our own country, but also in those other countries that we work alongside. When I came to World Health Assembly, it was at an interesting time in community pharmacy in Ireland because we were just entering into official discussions with our government on a new community pharmacy agreement. So we had the Department of Health, the Health Service Executive, who look after the day-to-day operations of public health in Ireland, and then the Irish Pharmacy Union. We worked together in terms of looking at improved funding for pharmacy, but also a greater role for pharmacists in public healthcare. So expansion of the role of pharmacists has been a topic that we've been advocating for a large number of years. And there's been a lot of work and movement in that space to actually really address that issue in Ireland. And being able to think about what was happening globally, learn from colleagues in other countries on things that they had done and initiatives they'd implemented really helped me as I was going in to advocate for a greater role for pharmacy in Ireland. And we've been able to secure a really good roadmap now for the role of community pharmacists in primary healthcare in Ireland. So we have a number of areas that we've worked on. Pharmacists' role in health promotion is going to be strengthened. We've got greater availability and accessibility of education for our pharmacy teams to promote that role. Pharmacists for the first time are going to be involved in the National Bowel Screening Programme, so in that detection of disease space and supporting patients to take that proactive step to detect whether they might have a condition and also to learn how they might be able to prevent it. We are going to be introducing a common condition service in Ireland, and that is looking at 8 conditions and pharmacists prescribing in the space. And as we work our way through how that service is going to be implemented in Ireland, that whole area of antimicrobial resistance, pharmacists being very familiar with national antimicrobial prescribing guidelines and now being actually able to really adhere to them in their own prescribing journey has been in our force. So that's a very important service that's going to be implemented imminently. We have a huge amount of progress made in immunisation in Ireland in recent years, but that's going to be further strengthened again. So recognising the role that pharmacists play, we administer in Ireland over 33% of the vaccinations for influenza and for COVID-19. And utilising that network is proving really key, ensuring that there's more patients vaccinated across the entire country. And we have more healthcare professionals increasing access, all of these themes that you start to see. So we've also got a role for pharmacists in continuing prescriptions for contraception, and we're going to be working towards independent prescribing into the future. So it's just, I guess, really useful to be able to say, look, these are not global priorities. And when you talk about the policy piece, you need to have a policy to be able to, as a department, then implement some of these things at national level. So being involved at the policy level on that global stage is really important, and people hearing about pharmacy and knowing what pharmacy does, and then being able to translate that down through to actually the day-to-day practice in pharmacy. So it's a really useful experience. Thanks, Catherine.
One thing that I've really noticed, Susan, and when I come on to my other panelists, is the sharing of experiences between nations when you come together at our Congress. So at the WHA, we're there to advocate for the profession, and almost at the Global Congress, we're there to sort out some of the tricky things we find. Is in every country, there's a bit of tribalism, there's a bit of fear from other professions, there's a bit of lack of understanding from some ministries, or governments change and suddenly you have a new health department. So even by just showing and sharing what you're learning in your country, you're helping another country at our Congress then work it all out. And I remember you leaving on the morning, Susan, the morning that you left, you were headed into those discussions. So
Yep.
that felt very, very real. And they were just culminating by the time we got together in Copenhagen.
Yeah.
Colleagues on the call, those of you who are members of our FIP Council, you will also note we're about to start a very big, important piece of work. The first step has been initiated by the Irish Pharmacy Union around the business case for sustainable pharmacy services. So some of the questions in the Q&A, we will be looking at the financial situations in countries, how healthcare is paid for, how medicines are paid for, how we argue for our services to be remunerated effectively and efficiently. That work will culminate in a white paper in Montreal next year, which is the request of the IPU and supported by Council. But we will be building on this work to 2030, Susan. As you know, the work is never over, is it?
Never.
We have to have a lot of tenacity in our profession, I must say. Thanks a million, Susan.
Thank you.
My next question then comes to Michael, Jack, and Philippe. And in that order, and I think I would really like for you to talk to us about the benefits you've gained either personally or organisationally, or drawing on some of the things that Paul was saying previously about integration of science, practice, education, etc., etc. What did you benefit from that you could take back and your organisations would benefit from by attending the WHA? Or what could you benefit from better now that you're looking at it with cooler eyes, so to speak? Michael, the floor is yours.
Thank you, Catherine. I appreciate being able to be a part of this. Good morning from California. I think that there's several things that I took away from engaging at WHA, and I think these are things that I knew inherently, but were emphasized to me at the moment. Number one is that being present at WHA, particularly because of the collaboration that FIP has with the other health professions, I was able to see the critical nature of how team-based care can move together. Some of you put questions in the question chat, which we may answer more specifically later, about physicians perhaps I think in Malaysia, Jack, being very protective and not wanting anyone else to provide the service. But I think what we've learned is that across the world, no matter what WHO region you live in, there's a shortage of healthcare providers, a severe shortage, including a shortage of pharmacists in many of our countries. And to think that you can do this alone or that you can go it alone is just an impossible thought. Plus, it's a very lonely place to live, thinking that you must do everything by yourself. So, I think we learned that collaboration is key, and there's so much that we learn in engaging at WHA. I had the opportunity to spend 2 hours. Now, I know this sounds a little silly. I flew all the way around the world to go to the WHA and had the opportunity to spend 2 hours with the president of the American College of Cardiology. I wouldn't have gotten 2 hours with the president of the American College of Cardiology anywhere in America. It would have never happened. But it happened at WHA because we were both interested in the same side event, which brought us together and allowed us to begin a conversation with that particular association. And the American College of Cardiology is rapidly becoming a very big advocate for pharmacist-provided primary care services, particularly as it relates to reducing the risk of cardiovascular disease and stroke. And I think that is just one very, very tangible example of how the World Health Assembly meeting brings people together in sometimes ways that you didn't expect. But in order for those opportunities to happen, you do have to show up. It's really important that you're present in order to do that. The second thing, Catherine, that I wanted to make as a point is that oftentimes when people think pharmacists, they think medications. But as your FIP's saying and statement goes, when you think health, you should think pharmacy. And that's a big shift in most people's minds because the average consumer around the world has not made that shift. They still think medicines. Here's the analogy that I would, two analogies, one of which I think for me is an important one. Pharmacists have been known for making medicines for centuries. Making medicines is an important part of our training and many of the things we do. But the reality is that commercially medicines are made frequently, and while we do still have some pharmacists that do compounding, making medicines is not the primary function of pharmacists these days. It's making medicines work. That's the primary function of pharmacists. Just a simple little twist on the words there, that making medicines work is what matters. And I liken it to a carpenter. Many of you would look at a lathe. A lathe is a tool that's used by a carpenter to make wood beautiful in its final steps. If you're constructing a piece of furniture or you're making something, and you would use a router and a lathe. Now, there's hundreds of people on this call, and I'm curious how many of you would be experts in using a router and a lathe. Probably fewer than 2 pharmacists on this call would be adept at using a router and a lathe. The router and the lathe are a tool. It requires the master carpenter to be able to use those tools to actually make a difference in create the work of art that's being created. Pharmaceuticals are simply a tool. They're the most cost-effective tool that can be used, but whether a pharmaceutical costs $1 or $1,000, it doesn't matter. Without the expertise of a pharmacist with that medication, to be able to help that medication to be used appropriately, it's simply a tool that sits and oftentimes, unfortunately, can cause harm to a patient if it's not used appropriately. So, helping policymakers understand that pharmaceuticals without pharmacists are simply a big risk. And while they can solve problems, the risks of the problems that they can cause when used inappropriately is much larger. So, in my opinion, the WHA gives us the opportunity to advocate for pharmacists as the master craftsman who helps ensure that the tool of pharmaceuticals are used to their best and brightest potential in the patients that we serve.
Michael, there's another thing I think from your eloquent description there of describing our contribution, our expertise, our unique selling points, so to speak. And the opportunity WHA gives us all is to spend time with a key purpose of advocating that message wherever we come from, as I mentioned to Faraz, that we don't have to worry about being a scientist versus an educator versus a practitioner versus a policymaker versus. But it also gives us these incidental moments where you find yourself in a room with perhaps a colleague from your own country, perhaps a colleague from somewhere else, and you might know that your colleagues in that country have some political problems. It gives us an opportunity to, frankly, spend time with each other as well, which I think in this day and age, with our busy agendas, is very rare. So it's a very good opportunity for us to hone those ideas together and do it through a collegiate lens and with friendship at the heart of it all. And I know you feel like that, Michael, because you are a real friend of pharmacy. But I'm going to hand now to Jack. I'll be back to you in a little while, Michael. Jack, your experiences.
Thank you, Celie, for the question. And Michael, honestly, this is the first time I've heard about the carpentry tools you mentioned. Sad to say, in Malaysia, the PhD boundary debate is not theoretical, it's actually structural. We are a system that where prescribers also dispense. It's an anomaly. Basically, we are not practicing the world's best standards. Therefore, attending the WHA with FIP is essential for us to build a strategy. Basically, we go to Geneva to bring back homework. So as case in point, just 3 days ago, doctors representing a National Medical Association just accused pharmacists of overstepping our professional boundaries. It's frankly, that's an embarrassment to team-based care, but it is what it is. So what for the Malaysian Pharmaceutical Society, the WHA connects us to the world's priorities. Astana on primary health care, universal health coverage, antimicrobial resistance, digital health workforce. We get the opportunity to meet our colleagues there and as well as from other professions to align it with FIP Development Goals. Then we embed it in our own programs. We build programs from what we learned in Geneva, and this includes the new preventive care framework we're trying to put in, our ongoing discussion with the doctors on vaccination standards, even new technologies like pharmacogenomics and digital health. And through it all, I think FIP's role has been catalytic, for the lack of a better word. You have given us practical toolkits, briefs, using the same languages that regulators will understand. And that's very important because when we talk to our ministry, our payers, we actually need to have evidence and safety, and a global evidence actually helps a lot. Lastly, as both Michael and yourself have mentioned, and the others as well, the relationships we built at WHA and FIP just pushes things forward, opening doors, making collaborations. I think this year I was in Geneva for less than 48 hours, but I had very meaningful conversations with pharmacy colleagues as well as doctors. And so personally, I think the WHA is something that reminds us that pharmacists is not peripheral to PhD. We are not at the side. We are the enablers of the system. At WHA, we don't only bring home photos, we bring home alignment, we bring home deadlines. We want to try and turn what the big news out there, the international promises, into national outcomes. And if need to, even mean overstepping or stepping up to advocate collaboration between doctors and pharmacists for the purpose of patient healthcare, so be it. Let's stop calling collaboration overstepping. Let's call it what truly it should be called: primary care done right. Thank you so much.
Oh, I like that, Jack. I think you came for 48 hours, but we didn't let you sleep. So you actually were doing 4 days in 2. Yeah, absolutely. Jack, I think that's a very mobilizing message. And I think for colleagues who find themselves in some tribal discussions and disputes in country, we should share that openly with each other and work on tactics for how to manage this. Without further ado, Philippe, your reflections.
Yeah, thank you. This is actually a most relevant question, especially in our context in DRC, where we pharmacists suffer from some challenges in integrating pharmacy services into primary healthcare. And I think that WHA represents a platform where we can learn from experiences from other colleagues around the world, and to learn how they have implemented the pharmacy services within healthcare, primary healthcare, and how we can replicate these models into our context. And also, especially for the last WHA, our Prime Minister was participated into a side event. Our Ministry of Health, participated into a side event hosted by NCD Alliance, and where he took 4 commitments for primary healthcare and non-communicable diseases. So one of the commitments was about expanding the WHO package of essential non-communicable disease intervention. And this is really a place where we could have advocate for integrating pharmacy services like blood pressure monitoring, diabetes screening. So I think being in this event would help pharmacists or pharmacist council to raise our voice and advocate for integrating pharmacy services into the primary healthcare. Thank you.
And Philippe, what we're noticing in many countries as we emerged out of the pandemic with a lot of fiscal challenges, even countries with established pharmacists at the center of primary healthcare are having to justify this again. So what you're learning and doing, everyone else has to go back and restart. And governments change, and then you have to restart the conversations again and again, whether it's Charlie's medicines plenary session, your symposia, if you like, Charlie, getting everybody there, to getting your health minister in the room to hear some key messages. We have to use all the tactics that we possibly can. Before we go to the questions and answers, my list of questions, my kinds of questions are really covered there as well. So I'm trying to do a double act. I'd like to go to Paul and Michael, really. And today is a 7th birthday of the Astana Declaration. And we have a new strategic plan at FIP. We have a lot to do in all our countries. Everyone's poorer and the health workforces are more depleted, but we have more of an opportunity than ever to really step up to the mark. Michael first and then Paul. How can the pharmacy profession support in filling the gaps in primary healthcare to accelerate progress towards universal health coverage and better health outcomes? And I'm going to Michael and then Paul and anyone else who'd like to just contribute before we just check the questions and answers for the responses we've all given. Michael.
Well, Catherine, I think there's an old saying. I don't know who to credit it to, but it says that we should bloom where we're planted. What that means is that regardless of the setting that you find yourself in as a pharmacist, whether it's in a hospital or perhaps in a community-based pharmacy or some other setting, that you have to be your very best and you have to flourish in the environment that you're in. And all pharmacists are clinical pharmacists. Your site or setting is, just happens to be where you're planted at the moment. And so we have to find ways to be able to address the local needs in our own communities because from one community to the next, even within the same country, the needs may be quite different in terms of meeting primary health care. And so we have to find the way to actually serve in our own communities and develop relationships. I think sometimes we think about this problem, Catherine, of primary health care and how the pharmacist has impact, and it looks like an enormous problem. And how in the world could we possibly make a difference? And the way we make a difference is by individually, one person at a time, one pharmacist at a time, one scientist at a time, saying that we will work with our community in relationship with those around us and that we'll find a way to do the disease prevention that's necessary to ensure that patients have access to safe and effective medicines, to make sure that patients have the assistance that they need in getting their blood pressure or their hemoglobin A1C or whatever under control. And I think it's just a personal commitment. And I think it has to start with that. I really think that's the core piece is to start with a personal commitment.
I love that, Michael, because I think everybody on this call and everybody who's representing an organization in their country does that with commitment and purpose and drive. And, I look at Luna, Jack, Susan, Charlie, Philippe, yourself, and Paul, and I can see that you're all driven to do the best you can at the level you're practicing at. Maybe that's nationally, but actually it's the pharmacists on the ground who turn the wheels day by day. And we have to keep that commitment and that drive. I think this is why the Astana Declaration uses the words of commitment very, very carefully and very clearly. I love that. One medicine at a time, we can transform pharmacy. It's brilliant. And no matter what the situation is, and you've heard Charlie's situation, you've heard Luna's situation, Philippe's, Jack's, Susan's, we're all in different situations, but the commonality is there. Paul, your final reflections on that, and then I'm going to do a little checklist of the Q's and A's of our wonderful audience.
Thank you, Catherine. Yes, I think the potential of the pharmacist is only just now being realised. We have a very, very capable, competent workforce, which needs to be fully leveraged and fully exploited by our policymakers so that those gaps in primary healthcare are filled from the ground up. And there is no other profession such as pharmacy with the potential to do that. People who advocate for pharmacy to the policymakers should be promoting solutions to them, solutions that pharmacy can deliver. And it's we've seen in the past 5 years in most of the developed countries, the past 10 years, the transformation that's happened in the practice of pharmacy. We are no longer just dispensers of medicines. We will always be medicine experts, but we are fast becoming disease state managers and prescribers and therapy advisors. The potential of the pharmacy is enormous. And I heard, as I said earlier from Dr. Faraz, that our pharmacy graduates need to be primary healthcare ready. And our educators need to fashion the curricula so that young pharmacists move straight into the workforce and are providing solutions from day one and supporting established pharmacists. So, Catherine, I think a lot of those gaps we need to fill from the ground up. We've only just started to realise the potential of pharmacists, both in hospital, in community, and in other practice settings. So I think that we have an enormous opportunity. And I think it is up to member organisations to promote in their country solutions to health workforce issues and primary healthcare gaps. And a lot of those solutions can be backfilled or can be solved, a lot of those gaps, by fully utilising a capable workforce such as pharmacists.
Yeah, it's so true, Paul. And we shouldn't underestimate our innate skill for handling things blind, if you like. If you look at the way pharmacy managed the pandemic week by week by week by week, where evidence was changing and the situations were changing in all of our communities, it was like pharmacists stepped into that role very naturally compared to having to wait for the whole situation. I think it's part of the pharmacist detective skills when you have a patient in front of you. What exactly are the problems? I love this. This is great. And for a day like today, when we are all facing fiscal challenges or political challenges in our nations, it's very important for us to remember what the good side of the ledger looks like from our professional perspective. Now, I'm going to ask my colleagues who have asked questions to make sure that their name and their organisation is there. When I look at the first question, what role can pharmacists by Vidis Alima, maybe I have that the wrong way round, I apologise. What role can the pharmacist play to help lower the cost of treatment? I think, Susan, this will fall out in our business case, our sustainability work for pharmacy. So I'd love this to be a case study in that work stream. And I'm looking at Susan, not because she's going to do the work, but because the IPU presented the motion to the council. The next question on the list is, why is it that healthcare ecosystems tend to place emphasis on pharmacies with regards to medicines and access, but not the practice of pharmacists as healthcare professionals? I think Michael touched on that and gave us some evidence for that. And I think our advocacy campaigns should just be the vehicle by which you in your country, Richard, can use the evidence of impact to best effect. Let's not, as Jack says, let's not meet the argument. Let's provide a purposeful, positive solution. We can, Louise Bazan, we can find out for you the countries where generic dispensing and substitution practices are allowed and get back to you. Harpreet, very well said. And I think Jack made mention of this. We're happy to help. You and I had a little side conversation. We're very happy to advocate both through our counterparts in global medicine, in global physicians, in global nursing, but also to governments as well. And then I think there's an anonymous question, which is, what advocacy strategies have proven most effective in elevating pharmacy's voice? The answer is all of them, all the time, to everyone. And as I mentioned to you, colleagues, where Philippe was saying maybe the advanced integrated services aren't known about by health ministers, in some countries they are, and you might have tribal politics going on. Luna, you mentioned about disasters and emergency situations and wars. Suddenly that's your priority. So we constantly have to go back and advocate, advocate, advocate. So I'm just going to look to the team. We've got 3 minutes for our closing remarks, but we will capture all of those questions and follow up with you. And I do think it's really important on the 7th anniversary of this day. So that's 47 years since, 47 years since the Alma Ata was signed up to. 7 years that where we have been playing our full and active role. And may I say, the next 7 years we have more to do. As Paul said, finally people are really noticing. Finally, when we go to WHA, we need more of us to be there, shoulder to shoulder, to be making the arguments for our contribution to universal health coverage through, as Paul would say, universal pharmacy coverage. And in some of our countries, we don't have enough pharmacists. In some of our countries, we don't grow our own pharmacists in universities. So we have to look at the whole system to make the change that we need. And then, of course, Susan, you come to Copenhagen with your health ministry signed up to a suite of services, I suppose the package that pharmacists are enabled to do. We still have people on the ground who need encouragement, support, enablement, remuneration. So the battle is never won. We constantly have to do this. Without further ado, I'm going to thank all of our panelists, my bureau colleagues, Dr. Faraz for coming, Louise, who has had to run to another WHO Europe event, Paul, it's the other side of the world and the other side of the time clock. Michael, I think you've got up before you went to bed in California, and everyone on every time zone in between. We've had 600 participants in the meeting, and we have a lot of work to do as a result of this meeting. I wish you all a very happy Astana birthday, and may I just say, shoulder to shoulder, we've got work to do. We'll do it together, and I look forward to seeing all of you, where at all possible, in the next year, and hopefully many of you at the World Health Assembly. Take care, all of you, and thanks a million, team. Wonderful. Paul, final remarks.
Thank you, everyone. A most worthwhile collection of views and benefits from the World Health Assembly. As I said, it was my first meeting last year. Enormous benefit, a lot of which I've taken back to FIP with me and back to Australia, and I would commend it to everyone. With our theme of the Congress in Montreal next year, I would encourage everyone to seek to try and get to Montreal at the end of August, early September, to join us for the World Congress of Pharmacy and Pharmaceutical Sciences. Thanks, everyone. Thank you, Catherine.
Thanks a million, Paul. Thank you all. Take care.